Welcome to Break Silos and Optimize Workflows to improve staff efficiency in healthcare. My name is Christina Wong, and I lead product marketing for the healthcare vertical at DocuSign. Today, we're going to cover how the DocuSign Agreement Cloud can help accelerate the business parts of your organization. We're going to share best practices and how our customers have implemented these best practices to help digitize and transform their operations so that they can break silos and improve efficiencies. Then we'll transition away from what DocuSign can do for you today to where we're going so that you know how to leverage our new offerings. With the DocuSign Agreement Cloud, I want to take you through 4 product offerings that are extremely relevant to the healthcare industry. So, in light of all of the uncertainty around the pandemic, whether it's related to staffing shortages, consolidation, changed patient expectations, or pressures on margins, the DocuSign e-signature product really provides you the option to automate your workflows for not only your patient-facing forms, but also your back office documents. This can range from your medical releases, intake forms, supply chain documents, or IT documents. We've also are really excited to say that our e-signature solution is interoperable with your EHR. We have live implementations with eClinicalWorks and other certified EHRs all through our interoperability partners. For those of you with clinical studies, we also have our 21 CFR Part 11 compliant solution. We see most of our customers using this in clinical studies and on their patient enrollment forms, but you can, of course, use it for any aspect of your clinical study that needs an e-signature. The other key product is our CLM solution. As you know, we also released CLM Essentials, and this is really how you can use a product to help you prepare documents, redline them, negotiate, but also serve as a central repository for your back office contracts. And lastly, our notary product. Our notary product is here to help you remotely notarize your legal documents or any other important documents such as advanced directives when your patients are unable to move or in the hospital, but yet they still need documents notarized from family members far away. So now let me introduce you to Ranna Vakili. She is our customer success manager who supports our top strategic health and life sciences accounts at DocuSign. She comes from a healthcare consulting background with a master's in health systems engineering. Ranna?
Thanks so much, Christina. So, as part of the customer success management team, I've had the privilege to work with our top healthcare customers to help them implement the most complex workflows and issues that arise. As a customer, you could be wondering what more could be done to leverage and optimize this existing investment. And from our experience, we find that the smoothest implementations and highest satisfaction come from following a few best practices. After introducing these best practice pillars, I'll provide a few customer examples on how we applied these concepts to some of our largest customers. The first step when working with a customer is use case discovery. This is an overall umbrella term for building out an implementation roadmap, identifying high impact use cases, and discussing any integrations needed. Following this roadmap allows DocuSign to align with the customer on use case priorities as well as timelines. A cross-functional team with an executive sponsor, the Center of Excellence, works with DocuSign to ensure the technology is implemented properly. A robust Center of Excellence not only includes an executive sponsor, but oftentimes individuals from legal, finance, support, as well as possibly a patient advocate if there are multiple locations. Working with the Center of Excellence allows us to have points of contact that can drive process standardization across the organization. This invites metric and audit trail reporting, as well as technology socialization across the business in order to break the silos associated with digital transformation. To add additional context to the above best practices pillars, I'll speak through a few mature hospital systems that have partnered with DocuSign and how we've worked in lockstep with them to shape their success. The Texas hospital system I'd like to showcase came to us inquiring how they can quickly digitize their patient consent forms during COVID. We knew their employees, like most customers during the start of the pandemic, were working remotely. So we needed to work fast and decrease the steps the patient access department traditionally took. Working together, we were able to highlight 3 of the vital categories I spoke about above: use case discovery, establishing a center of excellence, as well as process standardization. We started by establishing an implementation roadmap and timeline and identified the proper individuals who would lead the DocuSign partnership internally. After establishing the use cases and their priorities, we began the training process. And that looked like is teaching the Center of Excellence the ins and outs of the DocuSign platform, how to create templates and set up an API integration with their patient portal. The Center of Excellence then trained hospital administrators associated with each of the 6 hospitals that make up the network. The result, 1,800 users onboarded in under 6 months and 26,000 agreements sent on a monthly basis. These pillars were not limited to this use case. We now have use cases spanning from patient consent forms all the way to HR and their quality assurance teams. So the next case study I wanted to showcase is around a Swiss multinational healthcare company. This company organically grew to over 50 individual DocuSign contracts globally, but they lack the resources and centralized model to be able to scale efficiently. With their senior leadership's buy-in, DocuSign merged all contracts into one global enterprise license agreement. And then what this did was, it was crucial in boosting productivity gains, reduce costs, specifically labor, and allowed additional features and product sets to be available across the enterprise. So as we have built a strong foundation to scale the utilization of DocuSign with them, we didn't stop there. We are moving forward to identify further use cases and provide solutions for the specific needs within different departments. As you can see quoted on the slide, the process actually used to take a team of 8 people and 9 hours to complete, and now it's done in 15 minutes by one associate. And we also saw a 5x increase in their agreements sent monthly. So these examples above all showcase the positive outcomes that result from partnering with customers to use these best practices frameworks. So what I would do now is invite you to open up discussions internally and with your DocuSign account teams to ensure we are partnering for success. Thank you everyone for your time. I will now hand it back to Christina to discuss our partner ecosystem. Thank you.
Thank you, Ranna. I hope all of you can now see how the DocuSign Agreement Cloud can make a huge impact for you today, and that by looking at DocuSign across your organization, you really are able to help serve the patient across the care continuum and help with your administrative needs in the back office. We also want you to understand that DocuSign is investing more in healthcare. In fact, what we're really going to do is to invest a lot in our partner ecosystem. And this is so that we could be a key component in the overall healthcare ecosystem so that our technology works seamlessly with your current technology. We want to make sure that DocuSign leverages your current tech stack so that it can do more for you with your current investments. And that's why I'm here today and really excited to introduce one of our newest partners that we want to share with you today, Luma Health. And before I turn it over to Luma Health, I want to first introduce the next 2 speakers that are going to be in a fireside chat so that you can know who they are. Our first speaker is Aditya Bansod. He is the CTO and co-founder of Luma Health. He leads the technical and strategic direction of the company. He has over 15 years of experience as a product management leader, developing mobile solutions at Adobe and Microsoft and at venture-backed startups. Donald, he is with DocuSign. He's going to be leading this fireside chat with Aditya. He is our Senior Director of Corporate Development and Venture Investments at DocuSign. Prior to DocuSign, he led corporate development and venture investments for two of Cisco's business units and in a variety of financially oriented roles at Responses, Jeffries and Company, and Liberty Mutual. Now, let me turn it over to Aditya, who will give you an overview of Luma Health.
Thanks so much, Christina. I'm very excited to be here. My name, as Christina said, was Aditya. I'm one of the founders and CTO at Luma Health. And Luma Health, we're a patient engagement platform. We were founded on the vision that needing care is difficult, but being able to access care shouldn't be. And we've built a company to kind of go solve those problems. We were founded in 2015 with the goal of trying to service all patients across all care continuums in the United States. We partner with some of the leading health institutions across the country, from large academic medical centers, integrated delivery networks, federally qualified health systems, and individual clinics and physician practices. To do this, we've built what we call the Healthcare Engagement Engine. The Healthcare Engagement Engine is what we call the set of modules, services, products, and features that make it easy for you as a patient to connect with your provider at any point along the points when you need to get access to care. Whether it's upfront scheduling an appointment, you want to get access to care, to making sure that you show up well prepared with a very simple but natural language processing powered appointment reminder, to making sure you know everything you need to after you received care, and then starting back again to make sure you're on a care journey that leads you to a happy and healthy outcome. We put together an entire set of communications and access solutions, scheduling solutions, that make it straightforward and easy to make patients be able to navigate and access healthcare. To do this, we integrate with over 80 different EHR and PM systems, such as Epic, Cerner, Meditech, Expanse, Allscripts, Athena, you name it, we've got an integration to one of them. We put this together, and we're really excited to kind of take this to the next level by partnering with DocuSign. We're excited to partner with DocuSign to make it easy to make a very specific part of the healthcare journey incredibly simple for patients to complete. That's anything around intake forms, consents, new patient intake, insurance card capture at that front of the process. Normally, when you walk into the doctor's office and you'd fill out a stack of papers, we want to make that entire process seamless, easy, and digitized, and most of all, consumer and patient friendly. To do that, we're integrating DocuSign and Luma Health very deeply together to power an entirely new category inside of that healthcare engagement engine. So, how's it going to work? First of all, inside of Luma Health, we're going to make it very simple for you to actually connect your DocuSign account directly into Luma. From there, inside of any of Luma's existing workflows, you'll be able to take a DocuSign template that might have already been existing or build a new template inside of DocuSign and import it and link it directly into a Luma Health workflow. From there, based on the various events that happen inside of an electronic health record, that could be an appointment scheduled, a surgery scheduled, whether it's a patient who is now due for a consent, maybe a consent to treatment, a HIPAA consent that might be required. Based on those triggering activities of those 80 different EHR systems, we'll then trigger messaging to the patient that tells them, hey, it's time to go fill out these documents. Luma is an omni-channel communication platform. We deliver messages in email, SMS, voice calls, WhatsApp, anywhere that you might necessarily find a patient in their preferences and how they want to receive that message. And so in this example, patients will receive a simple text message that was kicked off from that EHR-enabled workflow to ask them to fill out a form and complete a mobile patient intake. When they click on that link, they'll go through the DocuSign experience that you know and love, directly built from the DocuSign templates that they would have imported in from step one. Now, the great part about all this is, underneath all this is our EHR integration engine. One of the things we're really looking to do is increase efficiency across all the different points in healthcare. So when a patient fills out a form with Luma that's powered by DocuSign, we're going to make it very easy and seamless for that document to land directly in the electronic health record, that system of record. And by doing that, make it easier for physicians, nurses, operations staff to reduce that manual entry process and being able to actually speed up patients as they come through, and in the end, providing a better patient experience along the way. So I'm going to ask Donald to come join me, and we're going to have a discussion about kind of what does this mean and how did we get here?
Awesome. Hey, Aditya, thanks for joining. I'm excited to be here chatting with you today. We're going to get the chance to talk about healthcare overall, about the partnership. Before we jump into that, I wanted to spend just a few seconds on DocuSign Ventures as a team here and give folks an idea of what we do and kind of our function in the organization. So we're a team within DocuSign, and we really help source innovation from the outside, both by partnering and investing in innovative startups that are in and around the agreement cloud. And by working with these companies, we want to bring that innovation to our customers to help them identify new ways to do things and new solutions that they can adopt to make their workflows and their processes even better. And so we see patient engagement as one of those innovative areas in and around healthcare. And that's why I'm excited to be here with Aditya today. So, Aditya, maybe I'll start at a very high level and then we'll work our way back in. But
Let's do it.
starting kind of at that macro 10,000 foot level, from your seat, and you have a unique seat as CTO and head of product here at Luma, what are the big trends that you're seeing in healthcare today?
Yeah, I mean, I think so, Donald, thanks for having me. And I'm really excited to kind of talk more about kind of the behind the scenes and a little bit about kind of where we think healthcare is going. And exactly the question you asked, I think is so important, which is like, what's changed in healthcare? And I think like for a lot of us, our experiences as consumers have really kind of evolved in the last couple of years. From the pandemic, we've all really started to have expectations that are consumerized as we experience any kind of service. And sort of like the DoorDashification of kind of services in general, patients are experiencing that same sort of thing or wanting that same sort of thing in healthcare too. Patients are consumers and consumers are patients. And that kind of that trend around how do you make it easy for me to get access to care, how I want it, when I want it, and in a way that's convenient to me, that's exactly what patients are starting to demand. And health systems are really starting to see that we have to come meet patients where that demand is as well.
Yeah, and that makes a lot of sense. I mean, certainly all these forces around us that are providing these services so easy, right, in that way, and it's very much what we've talked about at DocuSign. We've coined it the anywhere economy, right? You can have those services
Yeah.
anywhere and how you want them, and so that's certainly where we see healthcare going as well. Um, One of the things I wanted to dig in on was I loved earlier as you walk through the platform of Luma, and you guys solve so many different problems for healthcare organizations.
It's
I know
healthcare. There's a lot more problems to solve.
we're at the tip of the iceberg, but I'm curious right now with your solution set. What are the one or two standouts that you're hearing from customers today on pain points saying, "Hey, Luma, we really need help solving this." What are those one or two use cases that you would highlight?
Yeah, our customers are talking about access. Like access is kind of the top conversation that everyone's having. And that's been kind of this evergreen, everlong discussion in healthcare, which is, hey, we have these phenomenal providers. They're still hard to get access to. It's hard to schedule them. It's hard to talk to them. I mean, I try to call my daughter's pediatrician. I'm still waiting for a call back. And that's been, 2 days now. And so just that entire concept around access and communication, getting in front of the doctor when you want to see them and how you want to see them, even if it's as simple as a question of something minor or rote, it's so difficult. And healthcare executives are really asking, how do we make this better? And this has been kind of everlong and kind of said evergreen, but I think there's this entirely new thing now, which is in the last 4 to 6 months, which is these were problems that healthcare typically solved by throwing bodies at the problem. They would hire more call center operators, more medical assistants, whatever it might be. But just hiring is hard now. It's expensive. It's hard to find qualified people. All the things that we hear in the news right now. That's all true for
Not
healthcare, just
scalable
as
either.
yeah, it just can't exactly. Now it's the problem is not just you can't just hire your way out of a problem anymore. And so automation and making the entire process more streamlined, it's an all boats rise situation. Providers are able to service their patients better. That's why they got into medicine. The health system's able to service, their patients more effectively. That's better business. And the patient gets what they want, which is getting access to care and getting on their way to being healthy and happy.
Fantastic. Yeah. And you guys certainly help your customers with all those things. And we're looking forward to helping joint customers in that way. So when you thought about partners out there in the ecosystem that you could go and partner with, you chose DocuSign, and we're thrilled you did. But give us a little bit of insight into why you saw DocuSign as being a partner of choice for you guys.
Yeah, and the feeling's mutual. You chose Luma, and we feel very lucky and fortunate for that too. So but for us, DocuSign, it's one of those things where we were hearing it from customers, and a lot of our customers are in that position where they are looking for how do you make the intake process more seamless? How do I reduce people waiting in my waiting room with clipboards? How do I meet my patients where they are, which is like on their phones, they're on their email, they're knowledge workers, their moms, their dads, their grandparents, their grandmothers, whatever it might be, they're all over the place and they're busy people. And then they have a job to get done, which is filling out stuff just in the broadest context before they can even see the doctor. And ultimately, that's what patients are looking for. So our customers have been saying, can you do something like this? And when we have the opportunity to partner with, frankly, the world leader and kind of the category definer for this, it was a pretty obvious choice. It's what our customers wanted. It builds a great patient experience, and we can enable it with our deep healthcare engagement engine to connect to all these EHRs so that we can actually make it an operationally effective process for our health system partners and our clinic partners to work on. So I think it was a no-brainer. It was just like, best in breed application and, patient engagement, best in breed application in agreements. It's a marriage that makes sense.
Fantastic. Yeah. And we were excited to partner with you guys. I think as we think about DocuSign, consumers, we have a strong brand with consumers, right? A lot of consumers have used us in their important transactions of life, whether it's closing on a house or using us in the anywhere economy. Organizations also love us because we bring efficiency to those processes, yep. Right? We do away with those back office cumbersome processes. And the intersection of these two, of both the consumer trust and the employee efficiency, we believe we can bring this to healthcare as well for both patients and the providers. So it's not just one-sided. It is that patient-driven healthcare, but it's also providing value for the providers as well. And so by partnering...
honestly, one of the things that I think, I heard this from a customer fairly recently was they're an ENT doc and they want to be able to, give consents before they're providing like an ears, nose, throat procedure. And just being able to do that in the clinic is just wildly difficult. And I don't know if you've ever gone through this, like, okay, the doc says, okay, we're going to go do this. Then the nurse comes in, the nurse has the paper gets signed, the doctor comes back in 20 minutes, you're sitting in that room. And it's just like this entire process where the future, exactly like you're saying, it's the anywhere economy is right there in the clinic room too, right? Push the button, get the text on your phone, sign the document, and then the doctor's doing what you wanted the doctor to be able to do with you.
Yeah, absolutely. And that's a great example. And I've been going through a lot of that recently myself, having visited healthcare organizations recently. So I can definitely attest to that. The one thing I'll finish with also why we love working with you guys is obviously you make that patient journey just fantastic, easy. But you also provide value back to the providers, right, as well. So it's not just
totally.
Completely patient focused, but it's also providing value on both sides of the shop. So as we have value and that consumer trust and that organizational trust, you guys also bring that, whether it's, helping them schedule more effectively, especially when they have holes in their their daily schedule, right? They have a cancellation, they have a no-show. You guys are very effective at automatically filling those or helping them reach customers in new ways, whether that's telehealth or whatever that may be. And then the exciting thing is you do tie that all back into the EHR, right? That system of record that's so important for many of our joint customers. And that's one thing that I wanted to ask you a little more about. I heard you mention 80 plus integrations into EHRs. And so I can only imagine how busy you and your team have been, probably burning the midnight oil there doing that. That's a lot of APIs to go into. But tell me a little bit about how you work with those EHRs and how you're really additive to that ecosystem.
Yeah, EHRs are, they are exactly, they are the electronic health record. And when we think about electronic health records, we think about them as the system of record. They are the legal, place where the documentation of the medical activity a provider has and a patient have engaged in lives. That's the electronic health record is a system of record. We at Luma really look at ourselves as that next layer up, which is that system of action. The thing that takes that those events that are happening, patient needs a referral to a specialist, patient booked an appointment, and converting those into actionable events. That's that system of action. I think where we get really excited about this partnership is with DocuSign, we can actually layer on now the system of agreement. And we can put together a three-legged stool between the system of record, the system of action, and the system of agreement. And really that puts everything together in this like kind of stool where, we can actually sit the patient on top of to really provide a very effective way for them to get access to care, sit the provider on top of for, the health system to be more efficient. And really where it's, healthcare is an opportunity in rare case you get, it's not zero sum, all boats can rise. And with those three kind of systems of action, system of record, system of agreement, that's where I think the partnership really sings.
Yeah, no, that's fantastic. And we're really excited about that level of interoperability that you bring with EHRs. We've been investing ourselves in EHR operability with many of our partners, not just yourselves, such as No2, where we've connected DocuSign with eClinical and other EHRs. And we're on a journey to really bring internally on building an HL7 models to provide more connectivity to EHRs as well. So we're excited
It's
to work
super
with you.
important.
And, oh, absolutely. So, and we see that. We're almost out of time here. So as we wrap up, I'm going to ask you one big last question to look into your crystal
Sure.
ball here and tell us what's your vision of the future of healthcare and how does Luma evolve with that future?
Yeah, I think my vision of healthcare is, it's a little bit of this, right? It's, 10 years. If we take it out to 10 years, like who knows, but, we'll take a crack at it, Donald. So, I think for me, I think one of the really cool parts is happening is kind of how healthcare is expanding beyond the walls of the clinic, right? Where a patient who may be a diabetic is wearing a continuous glucose monitor, maybe getting readouts, and an algorithms understands like, hey, you actually, based on what I saw leave your fridge and what you ate and your glucose levels, I think we may want to actually suggest a conversation with a dietitian if that's interesting to you. I think one of the parts where Luma really, where we see at Luma, we want to always respect what the patient wants to do and kind of give them the guidance that they need to get access to the care that they want. And I think that as healthcare kind of evolves outside of the four walls of healthcare, whether it's telehealth, remote patient monitoring, new sensors, EHRs, your iPhone is an electronic health record, right? My Apple Health records are a health record, right? So all this sort of stuff starting to really spread out from just kind of very much me, my doctor's office, for 15 minutes. I think that's a really exciting way that healthcare is going to evolve. Luma Health, I think, is a really powerful part of how we kind of tie those pieces together to keep patients on a journey that leads them to the ultimate place they want to get to, which is happy and healthy. But, 10 years, pick a time horizon, shoot me an email and prove and tell me I was wrong, and who knows how it's all going to evolve.
Well, in 10 years, maybe I'll meet you in the metaverse and tell you how that played out. So
Yeah, exactly. I'll see you there with my NFT.
All right. I love it. Well, Aditya, it's been great chatting with you. Thank you so much for taking the time to spend with us here today, and super excited to be partnering with you guys. With that, I'm going to turn it back over to Christina to wrap us up.
Thank you, everyone. That was so wonderful. Thank you to my speakers, and thank you to all of you for listening and joining us. I hope you really enjoyed learning about how our top 2 customers are using DocuSign across all of their various departments, on how they first took a first step of looking and identifying those use cases, considering building a centers of excellence so that you could bring a bunch of departments together, and ultimately consider consolidating a bunch of your DocuSign accounts so that it can all be cohesive, so that together your team can break those silos and gain efficiencies. And I hope you're as excited as I am to know that we are really investing in our partners, and that this Luma Health DocuSign partnership is really going to bring tangible benefits to both your patients and your staff. And I really hope that you see that we are really investing in our partner ecosystem for you. So thank you again for joining us. Please take care and have a good day.